Thank you. Welcome to the November 10th. It's 9 o'clock. It's the Human Services Committee meeting, and we're going to start with Commissioner Douglas. Director.
I'd like approval to pay a TCM training in the amount of $375. It's targeted violence, terrorism, strengths and incidents.
Is there a motion?
So moved.
Any questions? All right, move to a roll call vote.
Martini,
Aye.
Basile,
Yes.
Bliss,
Yes.
Brockway,
Yes.
Mendez, absent.
Hearing no no's or abstentions, that motion passes. I'd like approval to pay criminal court order in the amount of $195,446.79.
Second.
And I'm assuming this is again 7:30's our old friend. Yeah. Any other questions?
This will leave $408,000 in contingent.
Any further questions or comments?
Any end in sight?
Is there any end in sight? Well, as you saw, I put on there, that was for 4 people for a total of 118 days. They forgot to bill us for somebody, so we got billed in 2 months. Okay. We got one was returned to us on October 6th, but we sent another one. So there's also an individual who we only billed for 1 day, and that's because the doctor's order did not continue for the additional 30 days. I did call to check to see if would we've ever received that bill. They have up to 4 months to go back and change that, so we may end up with that or not, but there is no end in sight, and we still have additional ones scheduled that we are working on. And this is the September bill, so next. Right. Okay, any further questions? Move to a vote.
Martini,
Aye.
Basile,
Yes.
Bliss,
Yes.
Brockway,
Yes.
Mendez, absent.
Hearing no no's or abstentions, the motion passes. So then I ask for approval for budget transfer from contingency in the amount of $195,446.79 to our criminal action plan.
So moved.
Sorry.
Any further questions? Move to a vote.
Martini,
Aye.
Basile, yes. Bliss,
Yes.
Brockway,
Yes.
Mendez, absent.
Hearing no no's or abstentions, the motion passes. I am asking for approval for a waiver not to do another RFP for another electronic medical record. I cannot renew their contract at this time without either doing an RFP or the board gives me a waiver.
We concur
Okay.
in doing this. It's been the result of significant discussion.
Discussions?
And discussion with the county attorney's office.
Okay. Is there a motion?
Yes.
Second.
Further questions? Hearing none, move to a vote.
Martini,
Aye.
Basile, yes. Bliss,
Yes.
Brockway,
Yes.
Mendez, absent.
Okay, hearing no no's or abstentions, the motion passes. I have one quick add-on for Community Service Department. It was presented to the budget team 2 or 3 weeks ago. I'd like to present it here, or would you want me to? Yeah. Penny's here now. Yeah, since Penny's here now, and we have to go into executive. Yes, no, I don't think this one we do. Okay. Which one?
To regrade it?
Yeah.
I don't think so.
Okay.
So we're looking to regrade a couple of our positions. Give them anything to look at. Well, I know I emailed to the whole.
I have it in email. Where it says community service regrades.
Do you want your computer to do it, or you have it there, or what? Okay. You could write it in an email if you want to just follow those. These are the titles that we're looking at. Here, you don't need all the rest of the information. These are the titles that we're looking at right now, and their salaries, we're just comparing each of these. And this is what we're looking to. Let's have the title. Perfect, thank you so much.
We are looking to regrade, so 4 of our positions, MNC positions. Supervisor and psychologist is currently an MNC grade 8. We would like to move her to a grade 9. Addiction recovery service program manager, who is a 7, we would like to go to an 8. Supervising social worker, who's a 6. There's 2 of them, one in the children's clinic and one also in the addiction clinic. We would like them to go to a 7. So after we reviewed some of their job skills and job work activities, we found that what was presented when the salary study was being done was not accurate. So we upgraded what is actually needed to be there. And found that they should be moved to the next grade. This is also because there are people who are the union who work under them. Their salaries are now starting to pass them, and they are the supervisors. They've been here longer. Just trying to give you guys a quick overview, but some of you may have heard it if you were on the budget workshop. Is there any questions, something specific you'd like to know?
This proposal is in the 26 budget.
And it's largely due to kind of the compression.
And there was some different, like I said, one of the job that was sent in when they did the salary study did not have the correct qualifications. So we needed to change that as well.
It's not an updated, because the position hadn't been filled since 2012. It was a job spec that was probably created at some point prior to that, which is prior to both of us being there.
Yeah.
And the qualification and differences between what we sent in and the current required ones are significant enough to warrant having a 1 grade increase. And that's what this whole, I don't think this is the first time, this could be the second or maybe the third time you guys have seen this. Because it came up last year at budget time too, but they carried on doing all of the duties that they're doing that are in addition to what was on their job spec, because that's what they do. But in trying to comply with civil service law, they should either not be doing those duties and staying at an old title, which would also be against the mental health law. So it's one of those things where to line everything up so that we're following the law. They need to be doing what they're doing, which they've been doing last year at the same salary. We're not asking for any kind of back pay. We're just looking moving forward as of January 1, if we could have them properly graded at the grades that we're requesting.
Thoughts from the committee?
Makes sense to me.
Do we have to vote since it's already in the 2026 budget? Should we vote to make everybody happy? Okay.
Just to make it.
Yeah. Is there a motion to accept?
Generally regrading, I think we have done that in the past. The only reason you might not be is because it's part of the budget, but I think to differentiate between the regrade and it just being thrown into budget and swept in with everything else, this would really be about regrade and
No, it's fine. We can go ahead and vote.
Second Rick's motion.
Okay. Are there questions? Hearing none, roll call vote.
Martini,
Aye.
Basile,
Yes.
Bliss,
Yes.
Brockwhite,
Yes.
Mendez, absent.
All right, the motion passes. Since DSS, are we up to your executive? What would be your executive session?
Yeah, the rest I could do.
Okay,
Thank you.
no problem. Since DSS isn't scheduled till 8:20 though, I'm sorry, 9:20. We could probably get through this. in 10 minutes, do you think? Feel good about it. Feel good. And this is for personnel.
It is.
So I move that we go into executive session for the medical, financial, credit, or employment history of a particular person or corporation or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation. So the executive session would invite in Jeanette Pavlis, Penny. I think Steve needs to be here. No,
The other guys don't.
the other guys. No. All those in favor?
Aye.
Right. So we're gonna move into executive session.
Recording stopped.
Okay, welcome back to the Human Services Committee. I'll accept a motion to come out of executive session.
So moved.
Second.
I believe we have one more piece of business.
Yes, I am asking to create, fund, and fill a psychiatric nurse practitioner position for community services.
So moved.
Second.
Any further questions? Let's move for a roll call vote.
Martini,
Aye.
Basile,
Yes.
Bliss,
Yes.
Rockaway,
Yes.
Mendez, absent.
Hearing no no's or abstentions, the motion passes.
Thank you. And are you guys aware of our elevator issue?
No.
No.
Our elevator broke at 242. It's been down for a week. They're supposed to get a part in today. They hope that's the fix. When I talked to Tim last week, he says if this is not the fix, it's gonna be long term. We have had to cancel and reschedule people who can't do the stairs. When there's space downstairs, which there's not a lot, we will try to meet people downstairs, but there's like one office, the old, where they were gonna put DMV.
Right.
If that's empty, we'll sneak in there and try to use it. However, sometimes we have 2 or 3 that need to be seen at the same time. I did want to make you guys aware, because if we cancel, we do offer a telehealth, but some people don't have the capabilities, or they just don't like it, so they don't. And I just wanted to make sure the committee is aware that that is affecting us. And of course, it's also affecting us and employees with medical issues that can't do the stairs, but hopefully today's fix is gonna be it. But I did want to make sure you guys were aware. If it goes long term, I don't know. He said it could be several months.
Oh, great. Okay.
This has been part of a significant discussion in Public Works, and also in part of the Public Works budget discussions. It's a difficult technical problem to solve, and they're trying to get it, and Jeanette is right, it could easily take a couple of months as they try one thing or another.
Okay. We'll hang on to that, see what happens. Is there further business?
I'm done. Oh, thank you.
Great. I am going to hand it over to Commissioner Winnie, and I also need to, so. I'm also handing off to Jill. She'll be the next.
All right,
And
thank you. So I'd like to start with some resolutions for contracts, and this is all pending the 2026 budget approval. We have so many, we start to seek approval in November and December for these.
I think it would be okay to like do them all at once.
Okay,
Is that okay with the other members? We have them in our notes.
Okay.
the first one is the contract with Cherry Valley Springfield School for one caseworker, who picks up the 17% local cost. The next one is the proposed blue for the 2025-2026 season in the amount of $350,000. That's approval to spend the allocation. Next one's Catholic Charities of Delaware, Otsego, and Schoharie counties for daycare registration and inspection for 2026. The allocation is for $98,544. PSS keeps $4,926 for administrative expenses, and contracts with Catholic Charities for $93,618. Okay, the next one's contract with Dr. Silverman for psychological services in the amount of $64,989. The next one's empowerment for families for parent coaching in the amount of $2,640. Next one is Parks DA Emerson testing for 2026, not to exceed $8,000.
What
for
is
drug
that?
testing.
Oh, okay.
The next one's community maternity services for 2026 for parenting ed. This is a 1-year extension in the amount of $210,389. The next one is the Crossroads Housing Contract, emergency housing, 1-year extension. Crossroads is seeking an increase in the rate from $60 to $65 a night. This is paid from our safety net line. Okay, they are keeping, if we go above 14 beds, The rate is $50 a night and they are keeping it at $50 a night. They're not asking for an increase in that amount. Okay. Okay, Sarah, do you?
Oh, I'll do the cooperative agreements. We would like to do a cooperative agreement for 2026 with IT department in the amount to not exceed $322,288. A cooperative agreement with the probation department to have a PINS probation officer in the amount not to exceed $50,000. Contract cooperative agreement with the fraud department, total amount not to exceed $78,987. Veteran Services Cooperative Agreement not to exceed $41,500. Office for the Aging for Medicaid, long-term care and home care services. The amount $142,625. And Office of the Aging to run the heat program, winter of 2025 into 2026 for the amount of $53,538.
I'm assuming all these things are in your budget already.
Correct.
Is there a motion? Or, yeah, a motion and then questions.
Does anyone have any questions?
Guess we're ready for a roll call vote?
Martini is absent. Basile,
Yes.
Bliss,
Yes.
Brockway,
Yes.
Mendez is absent.
We're still a quorum, right?
Yes.
We have it, yeah, okay. So,
Current resolution request, we have a resolution request. We'd like to amend our Opportunities for Otsego Transportation Initiative contract for 2025 year. There was some unused funding in the amount of $6,463 that we can roll over into this year that we would like to use. The reason, even though it's a small amount of $6,463, the original contract was over 14,000. This gets us over 20, so we just need approval to roll that money over and bring that in for 2025 funding.
Make that motion. Second.
any questions?
Martini absent. Basile,
Yes.
Bliss,
Yes.
Brockway,
Yes.
Mendez absent.
Thank you. Okay, Jamie.
All right. So we would like to ask for a budget modification. We would like to increase our social services admin, a 6010 446 100. And also our contract line, a 6010 549 000 in the amount of $6,463. That's the amount of that transportation initiative contract change.
Any other questions? All right, roll call vote?
Martini absent. Basile,
Yes.
Bliss,
Yes.
Brockway,
Yes.
Mendez absent.
Moving on to our fiscal reports. Our welfare admin percentage for September is coming in at 55.81%. Our records management is 71.19%. Agency housing is 70.21%. Switching over to the program, we're at 71.22%.
Next, I wanted to inform you that we plan to continue our MOU with probation for motel checks for 2026. There's no cost to that. But they're willing to go out and do motel checks for us. Okay, next is personnel. New hires last month were a total of 5, a paralegal, a social welfare examiner, a temporary social welfare examiner, a part-time casework aide, and a social services attorney. And then we have 3 new vacancies, a social welfare examiner, a temporary clerk, and a caseworker. Okay, for housing stats, Opportunities for Otsego Shelter is housing 6 families. Motel 88, we're utilizing 6 rooms. Crossroads, 17 rooms. Jeannie's, 1 room. And agency housing, all 10 homes are occupied.
That's.
And for OPD stats for the month, out of 7 calls, 2 of them were DSS housed individuals.
All right, what we've got.
Thank you.
Thank
you. Have a good day, everybody.
Yeah, you guys.
Thanks.
Hey, Tammy, if you're there, we're ready.
Good morning.
Good morning.
Okay, so I have our 2026 contracts on the agenda today. So bear with me and I'll try to go through these so that they can get them in the minutes correctly. We'll start with the Medicaid agreements for our home care services. We have 3 agencies that we're going to be contracting with to provide home care services. That's At Home Care Partners, US Care Systems, and Visiting Nurses Home Care. We then have 1 agency, American Medical Alert, that we'll be contracting with for our PERS units. Robinwood will be the assisted living provider. And then Dr. Friedel will be our medical director for the program. And that's for the Medicaid DSS contracts. And then the next set of contracts that we're looking at, we have a couple of extensions here, so I just want to provide that clarity in regards to the amounts. So we'll again be contracting with 6 different home care agencies for our home care services. That will be a total amount of $357,000. For our senior meals program, we already have our contract in place with Shannon in regards to registered dietitian. She covers that for us. We're going to do a 1-year extension with her at the same rate that we currently contract with. And then for Trinity Services, that amount is actually going to increase from the current amount of $655,000 to $675,000 for 2026. And that also will be a 1-year extension off of the existing contract we have with them. And then we'll be contracting with our local restaurants again, as well as Mom's Meals, to provide congregate dining services and home delivered meals. We are looking to sub-award our funding for home modifications and repairs to Otsego Rural Housing Assistance. That will be in the amount of $200,000. And then we'll be continuing contracts with our existing vendors that we work with for legal aid, PERS, transportation, and adult day services, which is the Krause Community Center. And we're hoping to add a contract with Woodside Hall as well to expand our reach there. You guys should have a list of these, but if you have any questions whatsoever, please let me know.
Do we need a motion to approve these?
Yes,
moved.
please.
Second.
Right. Any questions related to any of them? All right, roll call vote.
Martini absent, Basile?
Yes.
Bliss?
Yes.
Brockway?
Yes.
Mendez absent.
All right, so that passes.
Okay, so that's all I had. I just did want to give you guys an update. We are working, we sent out our fact sheet for our nutrition program to all of the food pantries a couple of weeks ago. Given what's happening with SNAP and the delay in that, we've been working with individuals, our senior population, either to double up their home delivered meal delivery until that they're able to get benefits again. And or provide grab and go meals to individuals who don't qualify for home delivered meals, but also don't have a congregate site within their community. So all the food pantries should be aware, not only of our existing services, we try to provide clarification. Some people believe that our services are income-based, so we try to make sure that they are aware that that's not the case. But also just to make sure that they're, taking advantage of our existing services, while people are struggling with the delay in HEAP and SNAP benefits. So if anyone has questions or if somebody doesn't fit into maybe our traditional services, let me know, because we are figuring out how to adapt as much as possible to make sure that our seniors have the resources they need. And that's it. Any other questions? Okay, thank you.
Thank you. All right, we're a little ahead.
Madam Chair, I have an additional item. I was planning to go after everyone was out, but if we got some time.
Yeah, I mean, Heidi's not on the schedule till 9:50, so.
Okay, so I would like to request a motion move about $270,000 out of contingency for the repayment of some Medicaid overpayments. We would need to do that basically when all is said and done by the December meeting. I believe the committee is generally aware of this situation, but we're getting to the time when we have to actually take action on this, so that's what I would be asking for.
You need a motion.
Yes.
Second.
Are there any questions?
And just so you know, the actual amount is $270,023.47.
Sorry about the 47 cents.
47 cents.
47.
Yep.
Well, I knew it was that much.
47 cents is kind of how your pocket, Steve.
Fine. I'll contribute for the good of the order.
All right, does anyone else have any questions? Okay, roll call vote.
Martini, absent Basile?
Yes.
Bliss?
Yes.
Brockway?
Yes.
Mendez, absent.
Thank you.
All right, thank you.
Okay, oh, that would take longer.
Yeah. Not much you can do with it. It's gonna take it back regardless.
Right. Well, the illusion of consent.
They don't get it any other way, they'll just dock it from future payments. If anyone here, keep coming on.
Usually comes online.
Should like a couple minutes out there. Sure. Always, one time, this, how fast are we?
9:45. I was sending her a quick text.
There's something about you wasn't here this month and somebody else was gonna be doing it. Might
Okay,
imagine,
right.
you might magic.
You actually remember something from last month? Yeah, when was last month?
I don't know, it's just whole Monday meeting instead of Tuesday. It's like really throwing me off.
You, yeah.
You, me and everyone else. Should I prepared myself this morning, but I guess not that great. Hey, he's walking in the building as we speak.
After all this, people wonder why our budget is so.
Hey Heidi, ready for me?
Yeah.
Okay.
You are very much on time. I just thought if you were coming on Zoom.
Yeah.
But no worries.
Okay.
We're just a couple minutes ahead of schedule.
Okay.
We're a slim committee today, but we're ready.
All right. Okay, sorry, I went up the stairs. Let's see, program updates. We have, only had a couple flu cases reported this year so far, beginning of October 1. So really not seeing that circulating yet. So still very good time to get your flu shots. We had 14 lab confirmed COVID cases in October. There was a bit of a spike in September, but it's come back down in October. And we're well below, October numbers were well below what we were last year. So, don't know if it's less disease circulating or less people getting tested, but, seeing less illness and less hospitalization, so that's good. Our community health assessment is in the final review stages with Bassett and our department. We will be submitting that next month. And that will be shared with all of you and be on our website. I had the special educator that started in September has resigned as of last Friday. So that leaves me back down to one teacher for the preschool program. The part-time, so this is where Steve might come in. The part-time position that we have, she was only seeing one child because she has a full-time job. She's retiring from her full-time job, so she wants to increase her part-time hours. So I'm hoping in the budget, we took out the money for that, which is fine if we don't fill this position, which I mean, it took us a year and a half to fill it. So I'm good. If I'm good to keep the part-time person on, we'll increase our hours. It won't be anywhere near 20 probably even, but to fill in that.
All this is for 26, not for the rest of this year or for the rest of this.
Right, for 26. Yeah, but the position is vacant now. So. So I don't think we have to do anything, right? Because just taking it out of the budget didn't lose that position or the funding. Okay. Okay, the first thing I have is a transfer to move $20,000 from preschool transportation to early intervention education to cover the costs for the remainder of the year. We've seen our early intervention costs go up. It has a little bit to do with the state system that's now a year old. It was implemented last October. They're not
maximizing Medicaid funds as well as they should be, so it's falling back on counties. So all the counties are seeing their local share go up. So we're working with the state and the programmers to deal with that.
Is this something like NISAC can help with or like advocacy
yes,
efforts?
Yeah. Yep. I think they're probably aware, but I can make sure through NICHO that they're,
Why do you think their Medicaid work has fallen off?
because the way that it's put into the system, so the way that the home visitors put the Medicaid information into the system was not taken appropriately into the system, so the system thought they didn't have Medicaid when they did. So Medicaid wasn't being billed.
So this is a
It's a technical.
staff training issue at
It's
the
a-
state?
Yeah, well, I think it's a program issue
Hmm.
with the technical piece of the system.
Oh, software.
Yes,
So theoretically, it's an easy,
yeah, theoretically, yeah.
yeah,
Yeah.
okay.
I think we need to vote on the transfer, right?
Yeah.
Second.
Any other questions? All right, roll call vote.
Martini, absent Basile,
Yes.
Bliss,
Yes.
Brockway,
Yes.
Mendez, absent. Thank you. And the next is, to accept, an additional grant. It's a little bit of a piece onto our children with special health care needs grant. It's, children with special health care needs, community accessibility and inclusion grant. For a time period of 10/1/25 to 9/30/26, and the total amount of the grant is $31,847. So this is just a 1 year, like push of funds into the program.
Motion to accept.
Yes.
So moved. Second.
Any other questions? All right, roll call vote.
Martini, absent Basile.
Yes.
Bliss,
Yes.
Brockway,
Yes.
Mendez, absent.
Right.
Thank you. That's all I had, except I did ask Adrian about an executive session.
Okay,
That's okay.
yeah, she told us, yeah.
Okay.
What? I don't know.
It's for the financial personnel. I emailed,
Okay. And who would you like to invite?
Steve and the committee.
Here it is. It is. Ready?
Yes.
For the medical financial credit or employment history of a particular person or corporation or matters leading to the employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation.
Perfect.
Yes.
All right.
I think I've never done that.
Any motions or anything?
Do we need a motion to go into executive?
I think so, right?
Yeah.
Second.
All right.
Are we going back?
Are we coming back out?
I don't have anything else after
Okay.
this, so I don't know.
Just what we're going into executive session, need a vote?
No.
Okay.
So we can.
So you'll adjourn in a executive session then?
Yes.
Or from, yeah.
Yes.
Okay,
Thank you.
perfect.
Recording stopped.
Thank you. IT.